For a deeper look into this outbreak and to assess if there's any hope in stopping it from spreading, I'm joined now by Dr. Ford Vox in Atlanta. In addition to being a physician, he's also a medical journalist. I want to welcome you to the broadcast. The World Health Organization is classifying Kenya as a high-risk country for the spread of Ebola. Can you talk to us a little bit about that statement and the concerns with this perhaps spreading to another nation?
The fact that Kenya may be identified at this point as another high-risk location is of great concern, and in this situation, an entirely new nation. Of course, this is a statement that the World Health Organization has just made at this point. The concerns about Kenya have not been fully laid out. Any African nation is not going to have as fully developed medical system to control this virus as would be desired. Unfortunately, the three hotspots of the infection are some of the poorest nations with some of the fewest numbers of healthcare staff, which have been utterly decimated at this point. Kenya certainly is a stronger country than many of the others that have been affected, but that risk is apparently real as well.
One of the other developments today, Canada has given up about 1,000 doses of an experimental vaccine to help battle the disease. What kind of impact could that have, do you think?
So it is certainly big news, the fact that a really state-developed vaccine in Canada, now licensed by an American company, is being made available to the World Health Organization to be distributed in Africa. Of course, we're only talking about 1,000 doses, which could be quite important if the vaccine proves effective for that number of people, but would not be expected to stem the tide of this outbreak. And indeed, if these 1,000 doses are delivered, it's not clear to exactly what subpopulation of people that will be delivered to. One interesting fact about the Canadian vaccine is that it apparently is something that can be given soon after the infection, 24 to 48 hours after a contact has been made. That's different than the typical preventative vaccines to which we are used.
Dr. Ford Vox joining us from Atlanta. Thank you so much for your analysis.